Today, we're jumping into a real medical detective story, and it all starts with a super common clue. A cough. But, this isn't your average run-of-the-mill cough. Nope. This is the kind of cough that shows up, unpacks its bags, and just refuses to leave. It's a mystery that a lot of people face, and we're going to follow the evidence to see where it leads.
So think about it. At what point does a cough stop being just, a winter bug and start becoming the actual soundtrack to your life? When does it get so persistent, so productive, that you realize your body is trying to send you a really, really urgent message? Well, that's the question right at the heart of our investigation today.
All right, so every good investigation starts with gathering the evidence, and in this case, the first clues come straight from the patient's own story. We're looking for a really specific pattern of symptoms that separates a simple chest cold from something much, much more chronic. And these clues, they paint a very specific picture. We're not talking about a little tickle in your throat. The key word here is productive. That means a chronic daily cough that actually brings stuff up. When you mix that with a constant cycle of getting one chest infection after another, feeling out of breath, tired, and maybe even coughing up a bit of blood, well, you've got a combination of clues that can completely take over a person's life.
Okay, so we've got our initial clues. Now it's time to bring in the forensic tools. The next phase is all about the diagnostic journey, where doctors use specific tests to go from just a suspicion to a rock-solid conclusion.
The path to getting an answer is really systematic. It always starts with a deep dive into the patient's history and a physical exam, just to confirm the story we've been hearing. But then comes the big one, the high-resolution CT scan, or HRCT. You got to think of this as the absolute gold standard of imaging. It lets us see the lungs in incredible detail. At the same time, a sputum culture helps us identify the actual bacterial culprits causing all the trouble, and pulmonary function tests tell us exactly how much the lung's performance has been hit. And this is the aha moment. On that HRCT scan, the radiologist is looking for a classic visual clue. The airways, the bronchi, they're permanently stretched out and widened. So when you look at a cross-section, that dilated airway next to its tiny little companion artery looks just like a signet ring on a finger. This signet ring sign is the smoking gun. It's what confirms the diagnosis, bronchiectasis. Now, a really common question is, hold on, isn't this just a really bad case of chronic bronchitis? And that's a great question, because this distinction is absolutely critical. So yeah, both involve a chronic cough and mucus, but chronic bronchitis is more about widespread inflammation. What we're seeing in bronchiectasis is actual structural damage, that specific permanent widening of the airways that you can only see on a CT scan. So that scan doesn't just find the evidence for bronchiectasis, it also rules out the other suspects, giving doctors a really high level of certainty. So we've cracked the what. Now we really need to dig into the why. Why do the airways get damaged like this in the first place? Well, the answer lies in this destructive, self-perpetuating cycle. Okay, so here's the official definition. Bronchiectasis is the permanent dilation of the bronchi. But the real key to getting it isn't just the damage itself, it's the engine that's driving it. This destructive 1-2 punch of chronic infection and inflammation. That combination is what absolutely cripples the airway's ability to clear out mucus, and that just sets the stage for a vicious cycle to begin. Let's break that cycle down. It starts with an infection. The body's immune system kicks in with inflammation to fight it, but the inflammation is so constant that it starts causing collateral damage to the airway walls themselves. Those walls lose their stretchiness, they get scarred, they widen. Now, these damaged, baggy airways just can't clear mucus properly, so it pulls up, creating the perfect breeding ground for even more bacteria to grow. And just like that, the cycle starts all over again, and it often gets a little bit worse with every single term. So what kicks this whole thing off? Well, the list of culprits can be pretty varied. Sometimes it's leftover damage from a really bad infection years ago, like tuberculosis. In younger folks, cystic fibrosis is a major cause. Other times it might be a weakened immune system, or a very specific allergic reaction to a fungus, or even a condition someone was born with. And, what's really frustrating is that in a lot of adults, a specific cause is never found. We just call that idiopathic. All right, the case is cracked. So now, the focus shifts completely from investigation to intervention. This isn't about finding a single cure. It's about creating a smart, strategic daily plan to break that vicious cycle we talked about and take back control. The entire management plan is really built around 4 clear goals. And it's not just about reacting to symptoms. It's a proactive strategy. First, physically get that mucus out of there to improve airway clearance. Second, attack the root of the problem by controlling the infection and inflammation. Third, prevent the flare-ups, the exacerbations that cause even more damage. And the ultimate goal behind all of this? To preserve as much lung function as possible for as long as possible.
And here is the toolkit for making those goals happen. On the physical side of things, patients use special breathing techniques and little devices every single day to clear out mucus. Then, on the medical front, antibiotics are absolutely key. Sometimes short courses for active flare-ups, and sometimes long-term ones to keep things at bay. Things like bronchodilators can help make breathing easier, while crucial vaccines act like a shield, preventing common illnesses that could kickstart that whole cycle again.
And for more specific, tougher situations, the toolkit gets even more advanced. If a particularly nasty bacteria like Pseudomonas decides to set up shop in the lungs, inhaled antibiotics can deliver medicine right to the source. And for that really frightening complication of severe bleeding, there's a specialized procedure called bronchial artery embolization that can literally be a lifesaver. So finally, let's look at the long-term picture. Getting a diagnosis for a chronic condition is, of course, life-changing. But understanding the road ahead and just how important active management is, that's the key to maintaining a good quality of life. So why is all this daily management so incredibly critical? Well, because without it, that vicious cycle just keeps on spinning, leading to more and more lung damage. And over time, that can lead to really serious complications like respiratory failure. The stakes are definitely high, and that's why being vigilant and sticking to the treatment plan just isn't negotiable. And that really brings us to the single most important takeaway from this whole thing. The power to change the outcome really lies with the patient. The key to a better prognosis, to a better life, isn't some magic bullet. It's the commitment to breaking that cycle of infection and inflammation. And you do that through active, diligent, daily management. So we end up right back where we started, but now with a totally new perspective. After following all the clues from a simple cough all the way to a complex diagnosis, what's the true power of getting that answer early on? It's not just about having a name for it. It's the power to step in, to take control of the situation, and to completely rewrite the story of that cough that just wouldn't quit. Thanks for joining our investigation.